All right, good morning, everyone. It is now 10:01 a.m. and we will begin our Program Planning and Evaluation Committee meeting. To start off, I'm going to turn it over to Executive Director Jane Yon so she can say a few words.
Good morning, and it's just a reminder that we're meeting today virtually due to the permissions granted in the state of emergency by Governor Northam due to COVID-19. So this meeting is occurring virtually with board committee members at their homes and staff at homes and some in office. We will do roll call votes when needed for any approval items, and we will share the screen. And this meeting will be saved to Rappahannock Area CSB.org's website as well.
All right, thank you for that. So to get started, we are going to start with healthy families. There are 3 items listed under that. And so if Ms. Wagaman is available.
We'll give Brandy a moment to share the screen.
Okay.
Yeah, very good.
Good morning, everyone. On behalf of Healthy Families, please report that they applied to the Community Relief Fund of the Community Foundation. Their second application was also approved, and so they received $14,160 to support telehealth. So this will be used for additional Zoom licenses as well as to purchase cell phones for staff. They have been doing the telehealth and working from home with personal cell phones. And so this will be a big help to the program moving forward.
Michelle, maybe you can go ahead and go through all through the three items for healthy families.
Yes, okay. The second item is the Spotsylvania County Department of Social Services sent out a opportunity to all partner agencies to apply for needs related to COVID. And so they requested canopies and Surface tablets and Zoom licenses in a total of $3,720. This is related to the car seat campaign. Usually Healthy Families does the big car seat event once a year, but they also work with families throughout the year who need car seats. And so they've been continuing to do that during COVID with a guided instruction. Usually the staff would get in the vehicle and assist with the installation of the car seat. They're not doing that. There's also a video and paperwork that is required to do
sorry,
that.
Michelle. Sorry, Michelle. Brandy, it's page 6. Page 6 and 7 is the next one. And then after this one, then we go to page 8. So this is the grant that Michelle's referencing now. Thanks, Michelle.
So the canopy would assist with being able to facilitate the guided instruction for the installation of the car seat. So a staff member remains physically distant and instructs the families on how to install the car seat. So the canopy would be helpful to protect against weather. And then the tablets are needed to help with the paperwork and the video so that families do not enter the building and they have access to these things external to the building, that they would facilitate the necessary paperwork and videos through their vehicles. So we don't have a status of that application, but they did apply at the invitation of Spotsylvania County. And the third item is United Way. I'm sorry,
page 8, Brandy, next page. Thank you, okay.
Healthy Families Rappahannock area has been a United Way partner agency for many years. They have been one of the largest grant awards through United Way, and a total of $70,000 the last couple of years. They were also, did not have to apply annually. They were part of a 3-year grant cycle. And as Rappahannock United Way changes their model to focus on the ALICE population, so that's asset limited income constrained employed, they're redoing their grant application. And so Healthy Families is applying for 3 specific program areas: the home visiting program, targeted case management, and then also Village Fathers, which is a support group for families that they facilitate at the hospital and had been facilitating at the Rappahannock Regional Jail. So they have applied for these 3 program areas, and we do not have an update on the status of that yet.
Thank you. So are there any questions at all? All right. So if we can have a motion to request for the request of funding for the Healthy Families Community Foundation Relief Fund, Spotsylvania County DSS COVID funding request, and Rappahannock United Way funding application.
So moved.
All right.
Who was that?
Linda?
Matt seconded.
Linda, thank you. And Matt, you second?
Correct.
Thank you.
Any further discussion? All right, so now we will move to the roll call.
So if you agree with the motion, please say yes. Debbie Draper,
Yes.
Linda Ball,
Yes.
Kia Hilton,
Yes.
Karen Calais,
Yes.
Matt Zarowski.
Yes.
Thank you.
All right, thank you.
I'm here now, Jane.
Oh, Nancy?
Yes.
Wonderful. Hi, Nancy. Nancy, did
Hello.
you hear the presentation?
Most of it, yes.
Do you vote for approval?
Yes.
Thank you.
All right, thanks. So next we will move to the extraordinary barriers list for May 2020 by Ms. Kabuchi.
Yes, we only have one individual on the extraordinary barrier list for this month. He was placed on that list on May 1st, and he is working through the NJRI process, not guilty by reason of insanity, and a conditional release plan has been developed, and there's a court date set for July 15th. Unfortunately, this individual is experiencing some increase in symptoms, so that could delay that plan being approved, but we're hoping that the he's able to, continue to receive care in the state hospital and those symptoms are resolved before court in July.
All right, thank you. Any questions? All right, so we will move next to the
A question? Should I just raise my hand or how would you like?
I
Anyway,
think you just have to speak up.
okay. It's so nice to see the extraordinary barriers list so low. Is this an actual trend? And what reasons?
Yeah, I think that, our staff have just been able to do a really good job getting people out and finding, finding housing and resources for people. And right now, we don't have people who are ready for discharge that have barriers. I don't know that that's a trend across other CSBs. I think we're just kind of in a good spot with people needing to come out and being able to find places for them to go.
Okay, let's hope it keeps up.
A little combination of hard work and luck, I think.
Congratulations.
Yeah.
Any other questions or comments? All right, so next we'll have the IACT update by Ms. Kabuchi.
Yes, so for the month of May, we received 16 IACT referrals. 15 of those were completed. One did not need to be completed because the child was admitted to a psychiatric hospital. 8 of these were for initial IACTs and 8 were reauthorizations. 7 were children from Spotsylvania, 6 from Stafford, 3 from Caroline, and we didn't have any from King George or Fredericksburg this time. And the recommendations for those children were 13 resulted in a recommendation for level C residential, 1 for a level B group home, and it was recommended that one of the children be discharged from residential services.
Thank you. Are there any questions or comments regarding the IACT report? No? All right. So next, we will move to the Information Technology Electronic Health Record update by Ms. Williams.
Thank you. So we in IT have been really busy. In the month of May, we completed 963 tickets, help desk tickets, which was slightly down from the 2 previous months, which saw 1,500 and then almost 1,200 tickets. So it is calming down a little bit. We are in the testing phase with the WAMS integration. You'll remember this is the integration from our electronic health record into the state WAMS waiver management system for the individual service plans completed by our developmental disability support coordinators. We are fully live with the current iteration of WAMS, and we are the first board who is successfully testing the next version, which goes into place July 1. So we continue to move forward with that. We were scheduled to have some changes to our state reporting, our CCS. State reporting that were to be effective July 1st. However, the state has extended that, and so those changes will not be effective until October 1st. The idea is to give us a little more time to work on making sure the WAMS integration is working before taking on the state reporting project. We have been working on incorporating those changes since about March with our EHR vendor, so we feel confident that we are in a good place with that as well. Zoom has been the name of the game this month. We had, for the month of May, we had 3,798 Zoom meetings with a total of 11,474 participants. So Zoom has really helped us continue to connect during these times with the individuals we serve and with each other. We did have some server room air condition issues, which Murphy's Law, when we are all teleworking, of course the server would go down. We have addressed that issue with air condition and added some temperature sensors that will now call and email us when the air condition goes down and the heat rises, so as to prevent damage to our servers. We have also upgraded our power time system, which is our payroll system, as well as updated Avatar's Cache program. This is about a year in the making. It is not a project we wish to undertake while everybody or many people are working remotely. However, in order to keep our electronic health record updated and secure and functioning and as efficient as possible, we needed to go ahead and proceed with that. So that occurred about 2 weeks ago. So we are ironing out any wrinkles that we find along the way, but that was completed at the end of May. That's it.
I would just add to Brandy's report that on the next page, the staffing, there is a staffing position that's frozen around data and state reporting, and we anticipate that to stay frozen at least through the end of this calendar year, and then we can reassess. So in addition to managing the Zoom and whatnot, folks are absorbing some of the other duties for that position.
I have a question.
Yes.
I have a question dealing with Zoom. Is Zoom HIPAA compliant, or is there a waiver for that?
Zoom actually has a number of different types of Zoom licenses. We have 80 licenses through Zoom that are HIPAA compliant. We were able to secure that so fast and quickly because we had already jumped through all the hoops when we added our initial 10 licenses back in the November timeframe of last year. So we had everything in place to, when we brought the additional 70 licenses on, to keep them HIPAA compliant. And so there are certain settings and certain things and functionality we do not have with our HIPAA compliant Zoom licenses, such as individuals are not able to record sessions or stream through those licenses. And also there are additional security protocols in place for those licenses, but all 80 that we use here at the agency for telehealth and those types of purposes are HIPAA compliant.
Okay, good. Thank you.
You're welcome.
Any other questions or comments? All right. Thank you, Brandy. So next we'll have the CIT Assessment Center report by Ms. Kabuchi.
So in the month of May, there were 41 individuals assessed at the assessment center. 4 of those were from Fredericksburg, 3 were from Caroline, 1 from King George, 16 from Spotsylvania, and 17 from Stafford. And you'll see Carrie Gent, our CIT program manager, provided you guys with a new format for the spreadsheet that shows the number from each locality by month. So you can kind of have a better picture of how that's going too.
Randy, that's the next page, 16. Oops, nope, too far. There you go.
Fran, I have a question. On the drop-off report, can we add one more column for a total?
Absolutely.
That way, you know, it's nice to compare by region, but also it'd be nice to see the totals from month to month, whether we're trending up or not.
Sure.
And then actually for the total for month, and if you scroll to page 17, Brandy, you will see the totals for May. So that's.
So yeah, there were 64 individuals who were brought in on emergency custody orders during the time frame of the CAC site time, and then 41 of those were able to transfer custody.
Any questions? All right, so if you could then now go into the ECOT report.
Sure. So for the month of May, there were 193 emergency assessments completed. 74 of those were under an emergency custody order, and 76 resulted in a temporary detention order. So you can see the number went down a little bit for the number of assessments, but there wasn't a huge drop in the number of actual ECOs and TDOs. So some of that's related to, there's a kind of a broad spectrum of crises that emergency services might address, and there's less people coming into the office to meet with us whose crisis might be a little less severe, but they are offering to meet with people through telehealth who might be interested in admissions to Sunshine Lady House or just need outpatient services. And emergency services is also still meeting with people in person in the clinic. So if someone calls or shows up there and having an emergency, they're able to meet with a live person in that program.
All right, thank you. Are there any questions?
Yeah, I have a question. I was wondering, is it possible to know the people that are transported? Are they transported by the police or by the new program?
Okay, so you'd like to have numbers on the alternative transportation per month?
Yeah, I was just curious if that's being utilized, or how much it's being utilized.
Sure. We can add that.
I mean, I think it's a great program because police takes that off the police department's plate.
Yeah,
when possible.
We could share how many went out of the area. So how many were hospitalized in hospitals other than Spotsylvania Regional or Snowden, and then of those who went out of the area, how many were transported by alternative transportation? Would that be?
Yeah, I just would like to see that.
That way, it gives you an idea of how many could have used alternative transportation, because we wouldn't use it for local admissions.
Right, right.
So out of area hospitalizations, and then alternative transportation we can add.
Thank you.
And our CSB for our region has been one of the higher utilizers of alternative transportation. So I know Carrie Norris is tracking that information, so I'm sure she'll be happy to put that together and share it with you guys.
Thank you very much.
Are there any other questions about the ECOT report?
Yeah, I've been a little sorry to realize that the alternative system isn't used for local transport, and I'm assuming it's because of expense. And no, okay.
It's more related to the time involved. So they have several hours to respond, and so an officer could take someone from Mary Washington ER over to Snowden in 15 minutes. And so you wouldn't want to wait an hour for alternative transportation to come, because they are navigating kind of who's in what location, and they have a little bit of time to respond. So it's more of a matter of, best use of resources, and also it's better for the individual to not have to wait a longer amount of time in the ER to be transported. So if we can easily move them, and at Spotsylvania Regional, it might be a matter of just taking them upstairs. And so you wouldn't want to wait for alternative transportation to drive all the way there to take someone upstairs. So it's a use of resources and a time constraint issue.
Remembering that the alternative transportation responds to the region. So they're responding. So they have an hour to 2 hours to get to the location, which the police would have to stay there anyway until they could transfer custody. So for us, it's really the best use to use them when it's out of area and it won't take 20 minutes to get to where they need to go.
I guess I'm a little surprised that it allows, and I'm remembering now, yes, that it's allowed, the program is allowed to take that long for the responder to show up to the pickup point. That I would think, especially in a fairly urbanized area, that puzzles me.
But so it is a regional response. So the contract that they have with DBHDS is by region. So they're responding to Harrisonburg and Stanton and Charlottesville, and so it's not, the alternative transportation is not just for Fredericksburg.
And it doesn't mean that they would take that long. It's just they do have that long to show up. They don't have a vehicle and a person to put at every single hospital in our in every CSB, our large geographical region.
Right.
Yeah, if I could say, they respond from Culpeper.
There you go.
Unless they're out somewhere else and they're driving from, back to the hospital kind of thing.
When they're available, they're in Culpeper.
Right. Yeah, there are a lot of logistics involved in coordinating all of it. So.
Great program, though.
And then the only other thing I would add to that is we're one of the higher utilizers of the request, but remain one of the lowest utilizers of state hospital beds for our region. So we're not sending people to the state hospital per capita as some of other locations.
Hey, Jane.
Yes.
Would you have any idea of why the other jurisdictions might not be utilizing it?
No, I wouldn't propose to guess.
They do have, pretty frequent regional and I think statewide meetings to review that kind of information, but I don't know that anything's been going long enough to really draw any conclusions from that.
Okay.
But if we hear any, we'll let you know.
Thank you.
Are there any other questions or comments for the ECOTDO report? All right, so we will now move to the May 2020 waitlist by Ms. Shawn.
Yes, thank you. And Stephanie is out on leave, so just presenting it looks a little bit different. We are not operating same-day access as just drop-ins due to the current crisis. We are scheduling same-day access appointments, so folks can call in, get a brief assessment with the clinician, and get an appointment for a telehealth intake, which is pretty typical with what most boards are doing. At the same time, we are seeing individuals that are coming into the clinic on an emergency services basis versus a scheduled intake for outpatient appointments. So two different sort of parallel avenues there in terms of accessing. For the psychiatry intake, you can see that there are 7 older adolescents, so that means 13 and above, adults waiting longer than 30 days for an intake appointment, and no children waiting longer than 30 days. And those appointment times, there are the literal appointment times of those 7 people. So it looks like people may be as short as a month delay and much as 2.5 months delay for getting that intake. And that excludes hospital discharges and other exceptions due to crisis. And then on the next page, 22, we can look on the community support services side. We do have 5 individuals on mental health residential service list. 1 individual, and I don't know, Joe, did he move into Home Road on the 1st? Joe, are you on mute?
Yes. We have, yes, we had 1 person move in, so we have 1 vacancy currently in our residential program.
Thank you, for mental health.
Mhm.
And then continuing on to the next page, before questions, page 23, ID services. And then we have 1 individual on the acceptance to Ruffins Pond, and we're assessing that admission date relative to COVID-19. We are doing virtual tours of some of the programs, which I thought was creative on the staff side to do. PACT team, we have 70 folks that are currently enrolled. Again, admissions to that program is a little bit stunted right now in terms of getting out face-to-face, but we continue to serve those folks to the best of our ability. Any questions? All right.
I think you got on mute, Jane. Okay.
Yes, sorry. Brandy's up next, Kia, if that's okay.
Sorry, I was talking and I was on mute.
Okay.
If there are no more questions, then we will move to the data highlights for July 1st, 2019 through March 31st, 2020 by Ms. Williams.
So remember, for the first set of measures, the behavioral health measures, there have been no targets set by the state, and there's no incentive or disincentive currently associated with these measures. The first set of measures are the suicide risk assessment. What you're going to be looking at is going to be our performance from July 1st of last year through March 31st. So the last month you'll see is March. It's the most recent data that we have. For the suicide risk assessment, for the adult measure, we have improved since July, and there was an improvement of 80% of last month for the month of February, and for the month of March, we're at 76.6%. For the child suicide risk assessment, we have made significant improvement in this measure since last July. This included making sure that our emergency services were capturing the screenings that they were already completing in a way that it gets pulled for our state reporting, so they get credit for it. So for what was being done already, we just found a way to adjust our system to make sure that we were getting the credit for completing the activity. For physical health coordination, we have not seen the impact of COVID-19 on these measures, but I anticipate that we will in the near future be able to start seeing some of those impacts. The first measure is for having an annual physical examination. We have seen this go a little bit lower. And just a reminder, this is for adults who are identified as having serious mental illness. And so we are encouraging and help supporting individuals to access a physical examination by a PCP at least once a year, and then documenting that. However, there was a time period recently where PCPs were not seeing anyone for physicals, and now there's kind of a backlog. So I anticipate we'll see an impact here in this measure. As well as for those who access our medical services, we're required to once a year calculate their BMI and complete some follow-up if they're outside the normal range. We have not seen a dip in this measure yet because our protocols is for the individuals they receive their BMI calculated each visit rather than just once a year. And so for our individuals that we currently had in services pre-COVID, those individuals had their BMI calculated at their last visit. So while I don't anticipate there will be a dip currently with this measure for new individuals coming in, we can't calculate a BMI for them virtually by Zoom. It's something that we actually have to collect the measure for and have them physically available. So I anticipate these numbers may dip in the future. For March results, we are still in the 90% for calculating BMI. Approximately 81% of those score outside the normal or typical BMI range set by the state. And for those who do score outside, we provide follow-up education and planning for about 88.4% of those individuals. And the final three measures are the substance use disorder engagement measures. And again, these are looking for anybody who receives a substance use diagnosis to have a service within 14 calendar days of that diagnosis. So we have seen improvement over the last couple of months. If you look back at July, you'll see that there was a high number there. The state DBHDS changed how this measure was calculated in August of last year. And so that's why you see such a big dip between those months. That change in calculation extended the period of time we're measuring after they received that diagnosis from 30 days to 90 days. So that negatively impacted us there. The second measure looks at, of those individuals that we do see within 14 calendar days, how many receive 2 or more services within 30 days of that first service. And again, we see that same dip from July. However, we're holding pretty steady with that follow-up. And then the final measure is looking at retention in services. And so they're looking for 2 additional services per month for the next 3 months after that first service. I will note that if an individual is seen on day 15 of this first measure, they're automatically not included for credit on measure 2 and 3. So measure 2 and 3 will never be more than the first measure. But again, no targets have been set for these measures by DBHDS. The next 2 measures that we look at are the developmental disabilities measures. The first is those individuals who are receiving face-to-face developmental case management service. And so we'll start seeing DBHDS is considering Zoom as face-to-face if we are completing all the requirements of a face-to-face visit that is typically required and documenting it appropriately. For the developmental services measures, there are targets set. Previously, these targets were 90%. They have been reduced from the statewide to 86%. However, we're going to still maintain our internal targets at 90% to ensure that we are meeting that mark. These measures are important for the Department of Justice settlement agreement, and so we want to make sure that we're always hitting the mark with these measures. And as you can see, we did take a dip in the January timeframe. This was due to a staff member leaving unexpectedly mid-month, and staff worked hard to try to get her face-to-face visits in. But you can see a consistent climb as we've rebounded from that. And then the second developmental support measures is in-home. So every other month, that face-to-face visit has to occur in the place of residence for the individual we serve. Again, that target is now at 86%, but we're maintaining our 90% target. And as you can see, we face a similar drop-off in that January timeframe, and we have rebounded back. Any questions?
Yeah, Brandy, I do. So the DD in home, the Zoom count for that also now?
Yes. We do have to make sure we code it a specific way so that it's counted officially in our data, and we've been watching that very closely to ensure that we're getting credit for all of that. But for the in-home and the face-to-face, Zoom does count for that.
Okay, and then going back to measures 1 and 2, and et cetera, the suicide assessments and on, are those, does the patient have to opt into that, or is that something that we completely control?
I don't believe there's any specific opt-in for the patient, for the individuals that we serve. This is actually looking specifically at one type of suicide risk screening. And of course, it doesn't capture all of the risk screening activities that we do kind of throughout an individual's time in service. This is just looking for when they receive a diagnosis of major depressive disorder. So it is looking for a specific screener that we do and that we capture in a specific way so that we get credit for it. The date that is completed must match date of diagnosis for it to count and for this measure. So this is just reflective of that one specific screening tool for that one specific population of individuals we serve.
Okay, thank you. What I'm trying to figure out is if the state does put a metric that we are going to meet, you know, are we solely in control of that metric, or are we, is it dependent upon you know, getting permission? That's my question. That's my underlying question.
We are to a certain extent in control of meeting this measure. However, I believe very shortly these metrics are going to be changing and will be more inclusive and kind of more and easier for us to get credit for the work we're doing. A lot of the things that we miss are related to just making sure we have the dates matching and sort of those kind of arbitrary things. And so the new measures that they're proposing are going to get rid of some of that. I don't know.
So I think, yeah, so I think really it's where it's a process issue, it's the date issue, the exact diagnosis. And I think that's why the state's looking to change that measure, is that we should be doing this risk assessment tool on everyone and not just somebody with a certain diagnosis at a certain time in their service. So I think it'll be a good thing that those pieces and parts don't have to be exact, because the intent of the tool is to do the suicide assessment tool and not focus on did they have the right diagnosis at the right date to do the right thing and those kind of things.
Yeah, and just to piggyback on Jane's comments, we did change our internal policy to just go ahead and do the risk assessment on all intakes, because it was getting a little bit, there's some other, it was kind of do one if this or if that or if this, and so it was a lot to track. And Brandy's been really helping us, because a lot of the ones that aren't documented isn't that they weren't done, but like they were saying, it was that they weren't documented in the right place, or they mismatched the dates and things like that. But we did change our policy to go ahead and do the risk assessment on everybody and not just these specific populations. Just because it made sense too, not just for data collection, but it made sense to be assessing everybody.
All right, thank you. Very good.
Are there any additional questions? All right, thank you for that. So next we will move to the DBHDS Office of Licensing Corrective Action Plan. Ms. Shawn?
Yes, so you'll see we received from DBHDS 3 corrective action plans, all related to the reporting requirements around serious incidents. And this brief summary, you'll see one was on April 1st that we received the corrective action plan, one was April 9th, and one was May 12th. As a reminder, if a serious incident occurs per licensing definition that rises to a level 2 or level 3, and I won't go into all that, we have 24 hours to report it into the CRIS system, 24/7, 365 days. So these 3 instances did not meet that time frame. The first one occurred, the pre-screening occurred by staff on a Friday evening. The incident report occurred on Monday. So we missed the timeline there. The second one, it the individual served let staff know that they had been hospitalized in the past, and the incident report wasn't submitted until a week later. And then the third one was a data entry and licensing, and they all agreed what was on the incident report and what staff submitted missed it by a day or two. So really a couple of things, and if you go through the next pages, Brandy, actions taken. There's been a lot of education. There's been a lot of double checking. You know, those kinds of things to be sure that we continue to stress the importance of this timely reporting into the CRIS system. I can tell you that this is occurring throughout the state, that the DBHCS is issuing these corrective action plans, and it's related to the Department of Justice settlement agreement that community services boards and licensed providers submit these plans within 24 hours of being notified of one of the serious incidences. I don't know that there's much more to say about that, is that we just need to do it. There are staff that are assigned for the weekends to enter it into the CRIS system, so it is monitored on a QA level. It's just stressing to all staff the importance of it. And in the past, we hadn't received corrective action plans, and now we are. Any questions? And then I will need an approval for the submissions.
I'd like to clarify. So you say what you were just finishing saying sounds like there have been issues like this in the past, but there weren't. It wasn't getting this kind of attention.
Yeah, yes. So if a report was delayed a day or two to be submitted into the CRIS system, an incident report, it didn't receive a corrective action plan as it is now.
The impression I'm getting is that the frequency is about the same.
I wouldn't say that. I'd have to go back and look. I wouldn't say that, that it's about the same. I think it's peaks and valleys depending on staff and education and what's going on. And yeah, it's just something that needs to be consistent message. And now it's become a more consistent message to all staff of the importance of meeting those timelines.
Are there any other questions or comments? All right, can we have a motion to approve the Office of License Corrective Action Plan?
So moved.
Second.
Thank you. And I'll go ahead and do a roll call, please, for the staff. If you agree, please say yes. Deb, I mean for the board. Debbie?
Yes.
Linda?
Yes.
Kia?
Yes.
Karen?
Yes.
Matt?
Yes.
And Nancy?
Yes.
Thank you.
Great, thank you. So that has been approved. So next we will have the operation review, coronavirus by Ms. Shawn.
Yes, so I don't have a handout or anything to display here, but just wanted to briefly talk to you about where we are with services. We're operating status quo as basically we have been for the last couple weeks, with a couple purposeful actions. One is to continue to order cleaning supplies, Lysol wipes, all those kinds of things, so that when we do return fully operational, we have those in place. We are looking at environmental modifications that we need to make at each of the clinic in terms of seating. So when that comes back in line, we are looking the first rollout of next week for a day at Myers, we're calling it. So individuals, well, Joe, I'll let you talk about it. And it's starting June 15th. So
Yes. So starting Monday, for individuals who are living at home, who are seeking to come back to day programming sooner than later, itching to come back, if you will, we're providing an opportunity where they can come into the Meyer site, which is currently not being utilized, for 1 day out of the week. And we've identified 15 individuals who are so willing. And so these are 15 individuals. So that what that means is 3 individuals will attend a day starting next week at Myers, for a day at Myers. So 3 different individuals every day, Monday through Friday. And that gives them an opportunity to get out of the house and be provided some level of support in day activities. And we'll utilize our current RAI staff to be able to do that at the site. And of course, in doing so, we've already established, but we'll be implementing all of our protocols for entering the building, with the screening, the PPEs, the cleaning, and the staffing.
So that's one change coming up. And then the second change coming up on the 22nd, we're looking for group home cohorts to go to RAI sites at each of the clinics. So still not bringing in people to the community, from the community, but the group home residents that have been living with one another, getting them to the group home site to reestablish day support services there a bit. So those 2 things are sort of happening in a soft opening sort of way from the DD side of the shop. We were looking at how we could bring back Kenmore Club a little bit more in earnest. I'm participating in a statewide group about reopening CSBs. Couple things there. DMAS is still not authorizing payments in any group settings. That includes Kenmore Club, group counseling, anything like that. So we're not going to do that with PSR until that would occur. We had been talking about, when we do that, it will literally just be a small group at a time with certain entrances, certain exits, screenings, touchless thermometers, all those things in play. But that's really at the moment a moot point until there's more guidance from the state about what's allowable. Folks pretty much agreed statewide that the 3 services that need to come back on quickly, likely at the end of what the governor's calling phase 2 and maybe even into phase 3, are more intensive substance use services, our PACT services, and our psychosocial rehab services. But everybody's really conscious of sort of the vulnerability of this population and making sure that that doesn't happen too quickly when some of the telehealth is working okay. For outpatient services, it looks like that's actually going to be one of the last ones brought online, because they're holding their own so well in terms of outpatient service delivery and therapy and medical services that are provided. And that makes sense, because it's hard to imagine a therapy session with masks less than 6 feet away in an office. And it's certainly hard to imagine group services close up. So the suspicion that I'm hearing on the statewide level is that's probably not going to change, maybe through the fall into the winter. And the other consideration right now is watching closely the numbers in light of the numbers of assemblies that have been occurring statewide, and whether or not that will have an impact on the rates. Any questions about that? I just wanted to kind of let you know where we were. Right.
If no other questions, other business, Jane?
Yes, we do need to go into a closed session. So I'm going to read, this wasn't on the original agenda. I'm going to go ahead and read the motion, if I could have someone then make the motion and second it, at which time we will take a vote. If when we go into closed session, we'll stop the live stream, and then we'll reconvene the meeting to adjourn, and then convene again for finance. So I do ask for the following motion, that Rappahannock Area Community Services Board convene in a closed meeting pursuant to Virginia Code 2.2-3711A to discuss A15, to discuss medical records excluded from 2.2-3711 pursuant to subdivision of 2.2-3705.5. May someone make that motion, please?
So moved.
And have a second?
I second.
Thank you. Any further discussion? Okay, so we'll go ahead and go into closed session. Brandy, if you can let us know when.
Sorry, just takes a minute to prepare. I'll let you know when we're back.
Yes? I see the notice. Okay, thank you. So we're going to go ahead and Kia, thank you for allowing me to read that we're going to go ahead and reconvene into open meeting for the committee. I will go ahead and call for certification. I'll do a roll call that to the best of your knowledge, we discussed only matters lawfully exempted from statutory open meeting requirements and only public business matters identified in the motion to convene the closed meeting. So when I say your name, if you say yes to certify, Debbie? You're muted.
Sorry, yes.
Thank you. Linda?
Yes.
Karen?
Yes.
Thank you. Matt?
Yes, I certify.
Thank you. Nancy?
Yes.
And Kia?
Yes.
Thank you. So we are back into open session.
All right. And so is there any other business prior to ending today's meeting? All right. So if there's no other business, then it is now 11:18 and Program Planning and Evaluation Committee meeting is now adjourned.
Thank you. For those joining for finance, that begins at 12.
Okay. Thank you.
Okay,
Thank
I'll be
you.
back.
All right. Yeah.